To fully grasp the concept of what PTSD, we may ask, how is it? How does it look like? And who does it affect? To start off, we need to define post traumatic stress disorder, or PTSD. It is known as a potential debilitating condition that impacts people who have witnessed or experienced traumatic situations, such as violent assaults or other frightening, shocking events. Post traumatic stress disorder is a psychiatric disorder that can occur in people who have experienced or witnessed a traumatic event, such as a natural disaster, a serious accident, terrorist attack, war, combat, rape, or other violent assaults.
Those suffering with post-traumatic stress disorder have a hard time feeling emotions. They may feel detached from others. This can cause problems in personal relationships and may even lead to behavioral problems in their children. The numbing and avoidance that occurs with post-traumatic stress disorder is linked with a low satisfaction in parenting.
Thanks, Wendy. We consider ethical issues related to the treatment of post-traumatic stress disorder (PTSD) in combat zones via exposure therapy. Exposure-oriented interventions are the most well-researched behavioral treatment for PTSD, and rigorous studies across contexts, population, and research groups provide robust evidence that exposure therapy for PTSD is effective and can be widely disseminated. Clinical procedures for prolonged exposure therapy and manualized exposure-oriented protocol for PTSD are reviewed, and we illustrate the potential benefits as well as the potential difficulties associated with providing this treatment in combat zones.
Cognitive behavioral treatment of PTSD with a young boy and his mother following the experience of a chronic domestic violence. This case study follows a 7-year-old boy who presented with symptoms of post-traumatic stress disorder following exposure to domestic violence beginning at a very young age. During evaluation of this young boy's symptoms, it became evident that his mother also was presenting symptoms of PTSD. Consequently, treatment for both this young boy and his mother was proposed. Cognitive behavioral therapy has been used widely with both children and adults to treat PTSD. Fortunately, treatments have been tailored for young children, preschool PTSD treatment, and for adults. Overall, these yet show qualitative improvements in this general emotional and behavioral functioning. Furthermore, this case study provides a framework for all the health services providers to implement conjoint treatment of similarly traumatized families. Pilot intervention for military leaders. Service members are at a substantial risk for developing post-traumatic stress disorder due to a trauma experienced during recent developments. Studies have been documented PTSD in 5 to 45% of military personnel. Yet, research indicates that only 23 to 40% of these service members seek treatment. Admitting to a psychological problem as opposed to a medical problem was found to be more stigmatizing to service members. Findings from these studies offer emerging evidence for using brief educational interventions to influence service members' beliefs about PTSD, treatment effectiveness, and willingness to seek treatment. Most believe that their military career will be harmed by admitting that they need treatment, which is not.
As we should all know by now, post-traumatic stress disorder, or PTSD, is an anxiety disorder following exposure to a life-threatening or other extreme event that evoked great fear or helplessness. PTSD is characterized by flashbacks, nightmares, and impaired functioning. Sadly, 70% of adults have experienced a severe traumatic event, and 20% of them develop symptoms of PTSD. When we think of PTSD, this is what usually comes to mind, and all the focus is put on the victim. What about the health professionals who help victims with PTSD? As a healthcare professional, you are in a unique position to help a victim identify whether PTSD is a potential root cause of their problems. The goal for a healthcare professional dealing with PTSD is to intervene as quickly as possible in the process of recovery for PTSD. Some of the ways a healthcare professional may do so is recognizing the symptoms of PTSD, taking a routine health history, and asking questions about previous trauma, being aware of local mental health providers, and referring victims when necessary. And lastly, being supportive and a positive encouragement to both the victim and their loved ones, and knowing that PTSD causes significant stress to everyone involved, not just the victim. So next time you think of PTSD and only picture the victim, remember there is a bigger picture that involves many more factors.
Service members are at sustainable risk for developing post-traumatic stress disorder (PTSD) due to trauma experienced during recent deployments. Studies have documented PTSD in 5 to 45% of military personnel, yet research indicates that only 23 to 40% of service members seek treatment. Admitting to a psychological problem as opposed to a medical problem was found to be more stigmatizing to service members, and most believe that the military career would be harmed by admitting that they needed treatment. To improve our knowledge of stigma-related concerns, the studies assess the value of 1 hour briefing with 201 non-commissioned officers to document and influence their knowledge and attitudes about PTSD, treatment seeking, and effective treatment. After the briefing, among other findings, participants believe about PTSD treatment effectiveness increased, and they had less uncertainty as to where to seek PTSD treatment. Findings from this study offer emerging evidence for using brief educational interventions to influence service members' belief about PTSD treatment effectiveness and willingness to seek treatment.
The U.S. Department of Veterans Affairs estimated that PTSD affects almost 31% of Vietnam veterans, as many as 11% of veterans of the war in Afghanistan. Soldiers experience deployment related post traumatic stress disorder, often struggle with emotions of guilt and shame as a central component of their PTSD. Returning veterans struggle with physical and psychological trauma. Although trauma in military comebacks cannot be prevented, providing training for the militaries before exposing to trauma may prevent PTSD. Family members of people with PTSD can suffer from secondary stress and may experience some of the same effects as PTSD. They can experience depression, anxiety, and even substance abuse. Attempting to cope with the challenges of caring for a loved one with PTSD can bring them those symptoms.
In conclusion, after seeing the effects, whom it affects, and its outcomes, we hope that PTSD and its treatment shed light to break the stigma and how the people are treated. Thank you so much for watching.